There have been many highlights during the last year, but I think the area which we should take greatest pride in, the quality of the many reports we've produced on workforce intelligence for the National Health Service, for local government and for public health, because they provide really good intelligence to help employers and a variety of professional organisations think about their workforce needs in an ever-changing, dynamic set of circumstances.
I'm particularly proud of a number of CfWI successes over the last 12 months, and these can be drawn from our work across health, public health and social care. In terms of health in the UK, our Maternity Care Pathways tool was commissioned by Health Education England and is being used by a number of providers, key maternity providers across the country, looking at workforce implications both now and in the future. We also provided evidence to support the healthcare submission to the Migration Advisory Committee, and this helped the Migration Advisory Committee make decisions about which professions should appear on the shortage occupation list. On the international front, we led a work package as part of a European Union joint action covering 34 countries across Europe and European health workforce planning and forecasting. We were also privileged to have been commissioned by the World Health Organization and the UK's Department of Health to provide workforce modelling support for the Ebola-affected countries in Africa, and those are Guinea, Liberia and Sierra Leone. In terms of other areas, we've updated our social worker modelling tool, and for Public Health England, we've delivered a number of reports which really helps them to look at the granularity and makeup of their workforce, which is a significant and vital workforce.
Over the last year, we've given more attention than ever before to that which our stakeholders require of us. Our products, we pride in them, but they're only as good as our stakeholders believe in them and use them. So we have worked assiduously with stakeholders, organisations and individuals to make sure that we take their advice about what they want, and therefore our products are even more relevant now than ever before. We undertook a governance review a couple of years ago, and in the last few months we've completely overhauled the way in which the Centre provides professional managerial advice from the services for which we have responsibility. The panel met for the first time in January, and I'm really proud to be able to say I chair it, and we have a panel of great experts who will be able to give good quality strategic advice to the Centre.
This coming year we will be sharing our expertise more widely across health, public health and social care, and also beyond England into other UK countries and internationally.
Well, over the next year, the National Health Service, social care and public health face enormous challenges in terms of simply being able to meet the expectations that the public have of us. And they require lots of consummately well-trained workers. And part of our task, part of our challenge is to make sure we can produce the kind of forecast that they will need to enable them to make sure that their ambitions can be fulfilled.
I think there are a number of really good opportunities for us this year, certainly in terms of how we enhance our methodology and embed new ways and innovative ways of working with our stakeholders. That'll be really important. But also I think the way that we work with stakeholders to really take an integrated approach to workforce across health, public health and social care, that's critical.